I am delighted to introduce my friend and colleague. We're going to call her Liz. She is Dr. Newnham, Elizabeth Newnham. I just keep scrolling to find your bio here. Oh, it's not a long one. It's quite brief. Dr. Elizabeth Newnham is Associate Professor of Midwifery at Flinders University in Adelaide and Fellow of the Australian College of Midwives. For 25 years, her clinical practice, teaching, and research has focused on seeking social justice solutions for humanizing birth through the development of 4 research streams: ethics, technology, environment, and practice. She has published widely in these areas and has been an invited speaker at events in Europe, the US, the UK, and Australia. Research findings have been translated into policy and practice changes and cited in international policy. She is one of the 4 founding members of the Global Birth Environment Design Network. Thank you, Liz.
Thanks, Davis. It's really lovely to be here. Thanks for all of us. Thanks to us, actually, for putting this on. I would also like to acknowledge that we're standing on lands of traditional peoples today. I couldn't possibly remember the names of the peoples. I'm coming to you from Ghana country in Australia, which is often called around the Adelaide and Adelaide Plains is the historical lands of the Ghana people, and pay my respects to their traditional continuing connection to country on land that was never ceded. So I'm going to talk to you today again. I'm trying to mix up my midwifery things with what I think might be relevant to architect and design people like yourselves. Some of us are midwives in the room. Is that changing on your thing? So just to orientate you, because I might go into a bit of a waffle here, I'm just going to talk first of all about place of birth and what I'm perceiving as a birth crisis currently. Talk a little bit about why this is happening. So I am going to talk a little bit about birth physiology, and Saraswati also mentioned that. I'm then going to talk about what I mean by humanising birth and what that relates to in terms of birth environment and what we might do about all of that. So just to start off with, most birth around the world actually happens in hospitals. In the places where most birth doesn't happen in hospitals, governments are trying to bring it into hospitals. So that's another kind of tension that we need to think about when we're thinking about where birth happens. And it's not necessarily that they should be going into hospitals, it's that maybe we need to have more midwives in the areas where people are giving birth. But just for an example, in Australia it's 97% of birthing people give birth in hospitals. And for the first time since ever, I should think, the last birth statistics, 49% of those people had a birth out of their vagina. Excuse the language, we often talk about vaginas in midwifery. You guys might not be so used to it. So under 50%. I just want you to kind of sit with that for a minute, because you might go, well, so what? But what we do know is that intervention rates are going up. They're sort of, the last 10 years have gone up by 10 or 20% in many countries. In Canada, and I have to say, I should have given you a call, because I was on the computer this morning trying to find recent stats, and it was not that easy to find. I did find this lovely document from about 10 years ago that preceded a maternity policy in Canada, and it gives you there just some rates from 20 years ago about the rising induction rates, rising epidural rates, caesarean births and so on. Yeah. Induction is one of the big problems with us as well. But what we're seeing, even though we've got all these interventions going up and up and up, we are actually not seeing any real reduction in maternal or newborn death. So what are we doing it for, if not for that? And these are just some maternal mortality rates in high-income countries. They've stayed pretty static across the last 10, 20 years because of clean water, antibiotics, good diet, stuff like that, that prevents mothers from dying. And as mentioned in the previous presentation, of course, systemic racism and other oppressions means that we are seeing higher rates of mortality in Indigenous populations. That's an Australian statistic. And in the UK, black and brown women are dying twice the rate of white women. So that's just to kind of set the scene a bit. And then I found this lovely paper, which was Canadian, looking at some of the stats just on the right-hand side. And that's talking about caesarean section increase, and that's a bit more recent. We know that once you get above about 15 to 20%, you stop doing any benefit when you have that higher rates than that, and start causing harm. We also know that we see headlines like this from all over the world, and yes, these are not in any specific kinds of countries, these countries all over the world. We are seeing dehumanisation, obstetric violence, suicide as a leading cause of maternal mortality in countries where, you know, women aren't dying of postpartum hemorrhage. So something isn't working. I have a bit of an issue with institutionalised birth, and I'll tell you why in a sec. But essentially, when birth moved into hospitals, it coincided with a bigger picture of medicalisation of birth, of a devaluing of midwives and midwifery knowledge, of actually supporting medical practitioners' learning, and it increased maternal mortality initially when birth moved into hospitals. So that's just something also to keep in mind, that I would say hospitals are not really the place where people should be having babies, generally speaking, unless you've got a heart condition or something like that. I also think, yes, environment affects culture and culture affects practice, and these things absolutely are intertwined with each other. And it's based on these ideas of risk and reductionism, and how can the practitioner get to the easiest thing that they need to get to. What's the best viewpoint? Where's the clock? Where's the instruments? And where is the space for the sacred and the connection and the humanism within all of that? It's not actually there most of the time. So some of the problems with hospital birth environments is this kind of visual journey to the place of birth. Where do you have to walk through to get to the room that you're going to give birth in? So in some home birth circles, or, when people know a lot about home birth, they'll say, the first intervention is setting foot out of your house to go anywhere else. Some people have to go through emergency departments and get signed in before they can actually go to the place. The centrality of the bed, the lack of privacy, the culture that says, hurry up, hurry up, hurry up. We've got people coming in the door. Let's get this going. We need to get you somewhere else. That causes intervention. the bright lights, the time constraints, and I love Mimi's paper as well, and I cite her all the time, because when you don't give time for things to unfold, then you start to really interfere in a big way. And again, just to reiterate the point that these are not happening in only over there kind of places. This is a survey from Australia, 2022, talking about maternity experiences of being bullied, coerced, physical sexual assault, and disrespect and abuse, and non-consented vaginal examinations were the two most common experiences. So I want you to think about that in terms of space and privacy, and I think they are so connected. So that's the scene. I think we're in a bit of a difficult spot. I think we have to get out of it, and maybe we can do that together. So just to talk a little bit now about what the physiology of birth and how that's important, which Sarah's also touched on. Labour is this kind of complex hormonal soup that is the hormones that it produces give you feelings of well-being, calm, connection, love, and they prime everybody to have this big burst of love, basically. I won't go into the nitty-gritty of those, just to say that it's there. Also, the ideas about pain that we currently often conceive of. When you talk about birth, people say, oh, it's going to be so painful, it's the most painful experience of your life, or how are you going to cope with the pain? These are the kind of social messages that happen. But actually, the studies that some of us have done, a good colleague of mine, Laura Whitburn, has done a lot in this area as well, and some lovely Nordic country midwives have done a lot in the space. But essentially, when you ask women what they think about labour pain, they don't find it to be like that. That's a kind of other construction. And often what they say is, it was really positive, or I felt powerful, I felt joyful, I felt euphoric, even though the pain was happening, or I wanted to feel the pain, or I felt like it was part of that transition to being a mother. So I think we need to really be centering the fact that when you have a normal labour and birth with the hormonal cocktail going on, that the pain actually triggers and responds to in a feedback loop, then pain is something that we can definitely work with, not against. And I think that's just important to consider. And part of this picture also, and any midwife in the room will have seen this zone that people go into when they are in an undisturbed kind of birth situation. And Orly Dahan, who I think is speaking, hello. It's very good to meet you, because I also cite your work all the time, because so we know about this zone. We've known about this zone for a long time. It's the hormonal cocktail thing happening. And if you've ever not seen a birth, I mean, people can look just quite out of it, you know. But this framing, which is, I think, key to moving out of the crisis that we're in, framing it as an actual evolutionary benefit, and that by disturbing it, we're not just potentially disturbing that person, but we're disturbing a process that means we are causing harm really reframes that picture for me, so thank you for that. And I'm looking forward to hearing you speak. But when we think about what we do in hospitals and what we have been doing in hospitals for 200 years, something, that's what we've been doing. We have been disrupting this process, separating babies, all sorts of harmful practices that may be partly the cause for all of those headlines that I showed in the previous slide. So what may be happening here, and the way that Leslie Page and I framed it in one paper, is that this over medicalisation and dehumanisation of the birthing process is a similar situation to the climate crisis. So it's caused by the same things, right? Like, we're reliant on these industrial models, we've got like capitalism happening, everything's profit driven, we've lost the humanity, we don't care about physiological processes, ecological processes, like we can just stomp all over everything and nothing's gonna, really matter unless it makes a dollar. That's the framework that, humanity, or at least the kind of colonising cultures, have been making life work within. So I think, decolonisation is really important. Looking at social and community care and values is really important as well. So what do I mean when I talk about humanising birth? Really, I'm talking about the opposite of dehumanising. Some people go to me, in philosophy, we're talking about post-humanism. You can't talk about humanism, and but that's my answer to them, is, it's the flip side of disrespect, abuse, dehumanisation. And I just want you to really look at this. This is the definition that came up with in the first conference on humanising birth in Brazil, 2000. And it's really a very broad concept here. So you can see it's like universal connection to life and all things. And, it's really coming back to that idea that we are all connected. And when we disrupt things in a very reductionist way, then we all lose out. Whether it's a spiritual thing or it's a social thing, it doesn't really matter how you view the world, but it's this connectivity that we miss out on. So we did just put things in a table for those people that like tables, just to sort of give you an idea of the differences between what we're talking about. I'm not such a fan myself. So this slide here, I'm going to explain to you my sort of antagonism towards hospital and industrialised birth. And this came out of my PhD stuff. And really what it showed was that there's this discourse of safe hospital birth, for a start, which is, I would say, a false discourse. And when I went inside the hospitals and looked at what was happening in them, what I found was very much a normalisation of intervention. So it doesn't matter, if we just induce you, or we'll just do this, or we'll just cut this baby out, that's all fine. Have an epidural. Everything's all fine and dandy and lovely. And the documents also reproduce this discourse. But anytime anyone tried to support physiology or give more time, which is how I got to Mimi's paper, or do anything else really, put someone in a bath, then that was immediately sort of, positioned as a risky practice. So there's this absolute paradox happening within hospitals that is untruthful in a way, and maintaining this dominance of medicalised safe birth, which actually introduces risk and introduces harm. So the big problem, and that's what kind of took me into this other spaces that Davis was talking about. So that was published as a book. It made me start thinking about ethics and informed consent, because the things that people were telling birthing people about the interventions was not really true. So, how can you say you've informed someone if you've only told them, two things that actually weren't factually correct, and forgot to say the other thing, which would have been really important. Technology, so the right use at the right time, judiciously. Environment, because what I learnt in that environment is that it really drove the culture and the practice and the experience. And obviously the midwifery practice is the other part of that. So what do we need to humanise birth? I would say we really have to factor in the physiology. Not in an everyone has to have a normal birth way, but we need to respect it, and we need to put it in the middle of everything, as well as the experience of the birthing person. We have to think about knowledge systems. Who produces it? Who gets to say what the truth is? And we need to, acknowledge other people's knowledges in that space, especially birthing peoples themselves. I think we need to really think about where birth happens, and I think we should get it out of hospitals as soon as possible for the reasons that Saras has given us the evidence for. So, linking now to the birth architecture, I'm just going to do a really quick whistle-stop tour through... Have I got time? Yeah, I'm all good. So Bianca Lepori was probably the first person that we know of to look at birth architecture, looking at birth spaces. And Marilyn is a very revered person in our community, then also did some work with Bianca. So that was sort of really, to me, where this whole thing started, sort of, 30 years ago or something, Marilyn? And this is a quote from a paper that she wrote, or chapter or whatever. And it's just a really interesting thing, I think, for designers to think about in terms of that sense of knowledge and who produces what. Because, what she says there is that she spoke about this into a room full of... I can't actually read my slides because they're so small, but, it was like, why would you be looking at this insignificant, weird little space, like a birth space? Like, who wants to do that? Everyone wants to build big buildings and, big sexy things that shine and sparkle. And so, you can really see that really birth environments have not been looked at properly, since before the kind of medicalisation thing, until very, very recently. Really a good thing to keep in mind. We're in a very much our infancy. So, I'm just going to sort of skip through these a little bit, because we've got the actual experts talking about a lot of these later. But it was just a bit of a step through. So this was the mind, body, spirit architecture. And you can see it's gone from these kind of lines and blocks into a more curved space. I've got very technical language about this. Then Marilyn, obviously, she will, I'm sure, talk about the bud set whenever you're talking. And also this other piece of work that she's done about the kind of emotional design brief. So not just the physicality of something, but how it makes people feel. And then Nicoletta, who's also speaking, has also done a lot of work about what the key points are for consideration about designing birth spaces. So you've got, the leaders in this field in the room for the next 2 days, so make the most of them. And then obviously our network came up out of a brilliant seed of inspiration from Doreen, and a few of us came on board. We have a chapter in a book that's coming out. It will be published hopefully in November. I'm supposed to be reading the proofs this weekend, but I'll see how I get on. If you scan the QR code, it gives you 20% discount, so they tell me. But this has got a lot of interesting stuff in it, and I'm sure you'll want to read it, about humanising birth. And we've got chapters from, there's an obstetrician. It was a bit hard to find an obstetrician who wanted to write a chapter on humanising birth, but we found one, and midwives and, designers and other people. So in that chapter, we talk about the case studies that are on the website that is being launched at this event. And this is one of them, the Terra Alta Birth Centre, which is, I think, the one you're referring to, Doreen. That looks very Swiss. It's very beautiful. So again, just thinking about feelings, designs, how you might feel when you walk into a space, the way that they've got the birth rooms set up. You can see here that they've got options for staying upright. There's no central bed anywhere. There's a nice big tub in the middle of the room. So really what it comes back to, and this photograph here is from Doreen's thesis, which I love, and I put in lots of my presentations, because what she says in that same part in the thesis is we have to think about ideas of delight and sensuality. And so it's not just about pragmatics. It's not about making sure that there's private places and green places and places for partners, although that is all really important, like Davis's research has shown. But it's about also something else. And I think that something else is what you can bring. So, I do think humanising birth is a kind of attention to a deep kind of humanism. It's also talking about care, and I've got a whole nother rant I could give you about care ethics, which is one of my other things that I talk about a lot. But it's about attention and human connection, and it's actually about love. And these are the things that we have to make space for in our environments. And if we can't do that because they're hurried, or because there's nowhere to put your stuff, or because people are separated, then you are causing harm to that process and to society, really. So this is my call to you as architects and designers to take up this hugely pressing social problem. Thank you.